Some were not.
It attracted soldiers of fortune and people who went to Iraq in order to make a buck. These were people who had no interest in fostering democracy in Iraq. They had no interest even in carrying out their instructions from the U.S. military. What they were interested in was in simply making a profit. They saw their opportunity and they went for it. And these are the people who we know as the war profiteers.
The profiteers were on their way, and the Iraqi people were about to pay the price. From the early days of the occupation in 2003, Iraq was awash with dollars and with promises of a new tomorrow.
$18.4 billion to the people of Iraq to rebuild the country.
Putting money into essential services like health care.
The budget for 2003 will be somewhere between $600 million and $800 million.
Money is flowing back into the healthcare system.
So what happened to all those promises? Dr. Ali Fadil is in a pediatric and maternity hospital in Diwaniyah trying to find out.
This hospital has just had a $4 million refurbishment. But where did all that money go? Not on vital medical equipment. There's a constant stream of children from Diwaniyah with severe diarrhea and dehydration. To rehydrate them, special fine drip needles, cannulas, are needed. This is a basic piece of equipment, very cheap. But an infant like this needs the very smallest of needles, and the hospital has none. Her mother has brought her here in desperation after another hospital spent 3 days trying unsuccessfully to get a large cannula into her. It's all too much for the mother who's watched her child suffer unnecessarily for so long.
So how come, after 3 years of occupation and billions of dollars of spending, hospitals are still short of basic supplies? Health experts who were in Iraq in the first weeks of the occupation say the mistakes were made from the start. This laid the basis for today's problems in Diwaniyah.
What we should have done is help to flood the country with simple equipment. The simple basics is what you need, including the management systems to know what you have and what you don't have. And those are the things that we didn't do. We went more for big-ticket, showy items that you could splash around for symbolic value than some of these less attractive but more important substantive things that make all the difference between life and death in an emergency room.
The first international health professionals sent in to rebuild Iraq's health service felt there were already good foundations.
Iraq had a very reasonable primary health care system. They had experts. I worked with some of them. They very clearly knew what needed to be done. If we had engaged with them and worked with them, I think we would have been much farther along now, because they understood, as we could not, their own healthcare system and what was needed.
But Coalition Provisional Authority boss Paul Bremer had a different blueprint for the Pentagon's new Iraq. Every official with links to the old regime was to go. It was called de-Baathification, but it was indiscriminate. So, along with Saddam's stooges and placemen, Bremer cleared out most of the people needed to run the health system.